Hello and welcome to another episode of We the Doctors. It's a time where medical doctors come into the studio to simplify health matters. Okay, today we'll be talking about something very interesting. Do you snore? Or do you know anybody that snores? Dr. Valeria is always like, I'm already suspecting him. Today we're talking about sleep apnea and snoring, okay? There's a relationship between both of them, but we're going to try and simplify it for you. My name is Dr. Jules, and I'm here with my colleagues. We'll be talking about that now. Before we dive into it, let me give you the simple definition, okay? Yeah. Sleep apnea is a sleeping disorder, okay, involving recurrent episodes of cessation of breathing. You know when somebody is sleeping and then all of a sudden they are kind of like choking. It happens a lot to some people when they snore. And sometimes they are even oblivious to the fact that it is happening to them. Most of the time, it's a third party, like their partners that tell them that, you know,
you were snoring while you were sleeping.
You were snoring while you were sleeping, okay? And it can mask a lot of illnesses. And it usually lasts for more than 10 seconds. That's cessation of breath. Have you ever experienced somebody snoring before? Let me throw the question to the table.
I think everybody has had someone snore around them.
My goodness.
Right? And usually when they snore, you're not bothered. You're not worried about sleep apnea. You're worried about the noise.
I know. My goodness.
Because the person is sleeping comfortably and you can't sleep. It's
it's one of those conditions that is as if it's the partner that bears the brunt of the whole thing.
Except when it's now sleep apnea.
Exactly.
Partner is even okay and all that kind of thing. You know, both of you can deal with it as a family and, you know, handle it yourself. But the one that is embarrassing is you go to a public place or you have an event and you probably just go to an event or you go somewhere and you just want to sleep, you know, for like few seconds. And the next minute everywhere is vibrating. And nobody can even hear the speaker talking because you came for an event and you just wanted to doze off, briefly and all that. And it's really, really embarrassing. But sometimes you can't blame these people. It's really not their fault. Sometimes they're not even aware of it. Sometimes it's because of some, you know, conditions and all of that are responsible for that. I guess we'll be talking about that later on.
Yes, we will. Like you mentioned rightly, snoring excessively can be a problem.
Loud snoring is one of the major symptoms of sleep apnea.
Yes.
Basically, you realize that the person is sleeping and then it's really, really loud and you got to, and sometimes
with
it's
different gears.
Different gears. And when you are still tapping the person, like, I can't sleep, and the person like that.
It's probably when the person is actually making that sound. That's in here.
That is the
sleep apnea because the person is actually choking, can't breathe at that time.
Absolutely.
True.
Yeah, that's what happens.
And when you talk about these symptoms, because that's basically what this is now.
True.
You have people wake up in the morning and then they have a headache.
They
didn't drink the night before. They were not ill the night before. They just wake up and then there's a headache. Look back, the person snored through the night and probably had apneic episode. Apneic episode means episodes in the snoring.
I guess that's because of that feeling you get most times when you don't sleep well at night and you wake up in the morning and you have a banging headache. So that time they tend to feel uncomfortable. They feel like they've not really slept. Really.
They sleep during the day most of the time. All attributed to the same fact that they didn't sleep properly at night. They are sleeping, but they are not sleeping. They are not resting.
So maybe we should add that to the last man rules. People that sleep when driving.
Can you exactly use Lagos for that kind of description?
No, but he's saying that if somebody is always feeling sleepy and the person obviously has no history of alcohol, you want to find out if the person, you know, is having any problem with.
On our roads, this guy got home by after 11 the night before, left his house by 4 a.m. Why would he sleep behind the steering?
That's another issue anyway. That's by the way.
Yeah, then they also have a dry mouth. And the reason why this happens is because the airway is blocked. They are trying to breathe with their mouth. So they wake up, you know, if you wake up and your mouth is very dry, you were mouth breathing the night before. So it's So
should we tie this up? Because when you snore at night, you don't know you snore. So imagine you wake up with your dry mouth
You know,
And
well,
then you
not
have
all
this
dry
headache.
mouths.
Yeah, don't
You
try,
have this
madam,
headache
so
and you feel like going back to sleep.
Oh,
You probably had
exactly.
apnea the
Okay,
night
make that
before.
relationship again. Say that
I'm
again.
saying you wake up with a dry mouth.
Yes.
You have a headache.
Uh-huh.
And then just just the way she said it, you wake up and you still feel like going back to sleep with these three
Exactly.
things. Then you
Exactly.
probably snored the night before, and you probably had apneic episodes the night before.
Yeah, that's if you don't have someone to tell you the truth. So maybe they fear you so much they can't tell you you were snoring.
No,
Or
but
they love you so much they don't want to embarrass you.
I
Just
know.
maybe.
So now with love, your partner can tell you that, my goodness, you were snoring a little bit last night, and since the doctors mentioned that it might be related to a health condition, maybe we want to check it out. So let's take a short break. When we come back, Dr. Yvonne will be leading us on some illustrations. Let's find out what actually causes the snoring. We'll be back.
Coming up next.
Anything that will cause it to relax in excess more than it's supposed to relax normally will cause snoring. Hi, and you're welcome back to We the Doctors. This is the illustration segment for those of you just joining us. We've been talking about sleep apnea. So now we're going to be talking about how sleep apnea actually occurs. But before we start that, we've been talking so much about snoring, many things like that, accusing people who snores, who doesn't snore. I want to ask us here in the studio, please, who snores at night or who has been told that he or she snores, please?
Dr. Wale, look us in the eyes. And
No, absolutely.
Culprit already?
I don't snore.
Culprit.
Well, if I snore, I wouldn't know.
Thank you, Dr. Jules.
I do not snore.
Okay, good.
Last time I asked.
We heard from them anyway. I don't know if I snore or not. I don't snore. However, so what happens. We all know that we breathe through our nostrils, but air also gets into your lungs from the mouth. So let's take it that the nose and the mouth are the openings by which air comes into the lungs. Going behind the mouth, you can see the air passes through all these structures here before it gets down into the lungs. When you're awake, you do not snore. It doesn't happen. I haven't seen it though. But when you're asleep, these areas, the muscles around here, tend to relax a bit. This doesn't mean you start snoring immediately, but anything that will cause it to relax in excess more than it's supposed to relax normally will cause snoring, because the passage now is narrower, and so it causes the vibration. You can imagine something going through a narrower path than before. So the narrower it gets, the more vibration you tend to hear. And like we said earlier, people that snore don't actually even know that they snore. Then it gets to a time where the airways is completely occluded, meaning closed. And so that's where you get the sleep apnea, because now air can't go through. And that's when most people tend to wake up and they cough, and the rest of them, they wake up. So that's the sleep apnea we're actually talking about here. There are a lot of factors, but the major thing that causes this sleep apnea is talking about this area, the muscles around here that relax. So many factors have been attributed. Sometimes we say old age, because people are getting older, so the structures around there are weaker than before. Sometimes alcohol also causes relaxation here. And you know most people take alcohol at night. So that one is a big culprit as well. Talking about anatomical abnormalities, which is what we are talking about now. Some people have tonsillitis, things like that could cause it. And again, sleeping position too. Anything that's going to cause these airways to be narrower than it ought to causes it. Let me tell you again, another thing that they don't want to hear here, but males snore more than females. From studies that actually been said. It's not like females do not snore, but males snore more. However, we are going to be giving you beautiful illustrations with pieces we have on the table, telling you how air goes through, which one is occluded, which one is open, and how the snoring occurs. So we'd like to start with Dr. Waleria.
Yeah. First of all, I want to justify the fact that male snoring more than females is attributed. Who drinks more? Who takes alcohol more? So maybe that's the reason why you got your conclusion. So don't make it sound like male have anatomical issues. Basically, if you have this, for example, as the airway passage, all right. Now, one of the things I'm not sure if you mentioned that obesity was another responsible factor for sleep apnea. If you realize a lot of people who are obese tend to snore. And what happens is this. See, let's imagine this. Has the fats around. Compressing this.
Exactly.
How can you breathe properly, basically, in this kind of situation? So that's why we tend to encourage people to work on their weights and stuff like that. We'll be talking about that more when we get to the segment, giving people about the tips and the preventive measures.
And additionally, you would think that when someone is sleeping, we want all the muscles relaxed.
Yeah.
When you get relaxation in the places you're meant to breathe from, you begin to have trouble.
It becomes a problem.
Because we don't want that relaxation. And that's what happens when you take lots of alcohol at night. Some people take some. Even smoking can relax those muscles around where you breathe from.
Yeah.
And then when you take lots of alcohol and then some drugs you take, instead of having an opening, this can't even open because this guy is well drunk. So it flattens out and then you get to snore at night.
Yes,
Exactly. And then one more thing that Dr. Yvonne mentioned, this is the airway, okay? And from the structures that you pointed out, we have the tongue, we have the tonsils. Like if there is a mass for any reason in this area right here, obviously, the person will have problems with breathing.
Absolutely.
And part of the structures that can cause this, things like the tonsils, when you have tonsillitis.
Being inflamed, yeah.
Somebody that has like somebody can have a heavy tongue.
Yes,
And
even
then
a
it will
swollen
fall,
tongue, yeah.
Yes.
a swollen tongue, and it can fall back and cause
Behind,
obstruction. A lump can even be present. By lump, we mean things like cancer, any growth within the airway can cause an obstruction and can lead to snoring.
So, well, I think we've heard it all. Well, I want to ask a question. What will you do if you're in a room with someone that snores? I don't know what they'll do, but I once saw a movie where a little boy was sleeping with his grandfather. His grandfather was snoring so heavily. The boy had to put socks inside the grandfather's mouth. Well, I'm serious. That was what happened anyway. But since we want to know more about this, we'll be going on the streets to find out what people will do in this kind of scenario.
Situation.
And we'll be right back after that. Please stay tuned.
Wow. I don't know. Well, all I do is put on my earpiece and play some good music. That's it. That settles it.
You just cover your ears with the pillows.
Oh, well, I try as much as possible to keep away from him, or maybe get something else doing if I can't sleep.
I will not beat the person. I will not fight the person. If maybe I'm beating the person is not waking up, I will start pinching the person. The person will wake up by force. I did it the first time, you don't wake up, I'll pinch you. I'll pinch you till you wake up. Then you say, what is it? What is it? You are snoring, I cannot sleep.
Honestly, I think I hit that person because I have one already. Every time if I hear that sound snoring, I will just tap in on the person. I tap the person.
I leave the room for the person. I leave the room for the person.
That could be annoying, man. Personally, I can't cope with it. So I'll either keep tapping the person or I'll just have to leave the room for the person. So for me, it's annoying. I can't just cope with it.
Well, I've never liked anybody who snores, but whereby you can't avoid it, there's nothing you do. You just say to yourself, I must sleep. And before you know it, you catch some rest.
I leave the room. I can't, even smoking cigarette, I don't like it.
Someone who snores, sometimes it depends on the position of the sleeping position of the person. If one discovers that maybe when the person is sleeping while the face is up, you can make conscious effort towards that. So once you observe that the person is snoring, you try to wake the person and so that the person can take a proper positioning.
Hello, and we're back. It's time for the interview segment, and we're talking about sleep apnea and snoring. And where else can we talk about this than the first sleep center here in West Africa? And we have it here in Lagos, Nigeria. Talking with us is the medical director of Sleep Medics Medical Center. His name is Dr. Donatus Ogbo. Welcome, sir.
Thank you.
Now, today we're talking about snoring. And it's not typical that we will have only snoring as the presenting complaint. What are the other complaints that we have that could present as sleep apnea?
It's something we take for granted, but it's become really a huge aspect of the healthcare system. Now, I'm going to start with just talking briefly about sleep in general, and the lack of it, which is called insomnia.
Yes.
Now, insomnia is something that most of us have been through. Every single one of us has at some point or the other had difficulty sleeping.
Right.
That's called insomnia.
Yes.
And there are various types of insomnia. You have onset insomnia, which is the inability to fall asleep. You also have maintenance insomnia, which is the inability to stay asleep once you fall asleep. Now, we treat all of these in different ways, and there are different reasons for them. But for the most part, behavioral modification is the way we prefer to treat them.
Okay.
Sometimes we have a need to use anxiolytic medications and also medications that help induce you into sleep.
Okay.
However, that's really a very small
aspect
of sleep disorders. Okay. It would be great if that was the only reason why we actually have this interest in sleep medicine. However, there is something called obstructive sleep apnea, which is really what drove the establishment of this center.
Okay.
The reason is because it's the most serious sleep disorder problem, and if it's undiagnosed, it can be fatal.
Exactly.
Studies have shown that there are different aspects of our health that it affects.
Okay.
Now, let me start with defining what OSA is, which is the acronym for obstructive sleep apnea.
Sleep apnea.
Okay. It's basically an obstruction of the airway, the upper airway in particular. And what happens is that in certain individuals, particularly people who have crowding of the airway, and how would you suspect that? You know, you look at the neck size of the individual.
Exactly.
Okay? The neck size looks bigger than the normal, the average.
Yes.
Chances are they have a crowding of the airway.
Yeah. So the person is in bed and cannot even breathe, and nobody can tell this person is choking.
Basically choking.
Basically. So what you have here, because I can see behind you, we have a bed and there's a camera, and tell us a little bit about that and how it works.
Yeah, if we suspect that somebody may have obstructive sleep apnea, and there are so many other symptoms, and I think I may want to talk a little bit of those symptoms before I go address the issues you have. Now, besides the snoring, these people wake up very tired during the day.
True.
They're fatigued.
Because they've not rested properly.
Because they haven't rested properly. They've been in bed for 8, 9, 10 hours. However, they have not had any quality sleep, or what we call restorative sleep.
Yes.
The reason they don't have the restorative sleep is because generally when you have an apneic spell, the concentration of oxygen in your lungs falls.
Exactly.
And when it falls, then the blood cannot extract oxygen.
Exactly.
This causes a condition called hypoxia, which is a fall in the oxygen level.
Right.
The oxygenated blood flows to the brain. The brain detects, it takes the brain about 10 to 60 seconds to dictate that the oxygen level has dropped. And what it does is that it wakens the body.
To help them detect where the problem is.
Absolutely.
And how to help them with, I'm sure there's a machine that we also looked at.
Yes.
The CPAP.
Now, the sleep study essentially involves monitoring of the brain waves, which is called the EEG.
Yes.
And then your eye waves, blinking of the eyelids, okay? The muscles, or the EMG, and then finally the ECG, or the electrocardiogram, which monitors your heart rate.
Which will tell us how every part of your body should
is
be
functioning while you're sleeping.
Yes,
exactly.
The sleep state.
So the bed, like you can see, is a very comfortable bed. The idea is to mimic exactly the same condition at home.
Okay.
Okay. We have an infrared camera.
Right.
And the idea is that once the lights are turned off, the technician who monitors your sleep from the other room there should be able to see everything happening in spite of the darkness. That's the job of the infrared camera.
Okay.
And every aspect of your sleep is monitored.
Okay.
If you're snoring, we have a snoring microphone that
Okay.
actually can tell you the level, and from there, if you stop breathing, sometimes they will open up the door, call your name, shake you, wake you up, assuming the apneic spell is lasting for too long.
Right.
So this is all monitored. Your ECG, your heart rate is being monitored, your blood pressure is being monitored. At the end of the study, which generally takes anywhere between 6 to 8 hours, okay? If we suspect, prior to the end of the study, if we suspect or if the evidence is there to show that you do have sleep apnea, we do what we call a split study. Split study means that halfway through the study, we put you on the CPAP machine, which I will get to eventually. And once we alleviate that, the snoring stops, you begin to sleep better, and that is all monitored as the sleep progresses.
Yes.
At the end of the day, we're able to determine what pressure on the machine that obliterated the snoring.
The snoring in the first place.
That's usually the pressure at which we set the machine when eventually you get a CPAP machine.
When I took the tour earlier, I saw the whole the graphic presentation on the monitor and how this CPAP machine helped. I see we have the illustration. Some go on over the nose, some go over the mouth, and it depends on the patient. I'm sure some people might also need surgery as well.
Surgery or a tracheostomy is the last resort.
Exactly.
You know, probably less than 5% of patients with sleep apnea or obstructive sleep apnea actually need surgery.
To that.
You have to have gone through the process of either a CPAP, auto CPAP, or a BiPAP before we get to the point where we recommend surgery for you.
Exactly.
You know.
I'm just so grateful for your service, and thank you so much for your time. Thank you for joining us on the show.
Thank you, Dr. Joe.
Yes,
and thanks for having me.
Thank you. We the Doctors continues right after the break, and you know where to follow us on Twitter is @WeTheDoctors. The show continues. Don't go anywhere. We'll be right back.
All right, you're welcome back. If you're just joining us, this is We the Doctors. My name is Dr. Valeria, and we have been talking about sleep apnea. Now, sleep apnea might sound a bit technical, so you may be wondering what are these guys talking about. But if you're just joining us, we've been talking about snoring, basically. We've had very funny opinions about snoring and what people do when people snore around them. Now, in this segment, we're going to be giving you how to prevent, that bad habit, so to say, really, the embarrassing situation. Now, one of the things we had mentioned earlier was that obesity could be a major factor to cause snoring. Now, in this segment, we'll be encouraging you to try as much as possible to lose some weight and exercise. That should be one of the major things you want to work on, because that way it would help to decrease the pressure you're giving on the airways, and there will be proper flow and all that.
Yes, and again, when people have a flu, when they have catarrh, stuffy nose over the night, it's the same thing because it blocks the airway, so they tend to snore. So you want to use a nasal decongestant. But the thing about it is that you should be careful using it because it has its own side effects. So little, yes.
Exactly.
And if you already know that you snore, alcohol shouldn't be your friend at night.
It's
simple. Because if you snore, it's going to flatten your muscles, relax them to the point that you can keep on snoring, and then you wake up tired in the morning. So why don't you just throw away the alcohol for the evenings? Maybe in the afternoon you may want to try it, but not at night before you sleep.
Alcohol in the afternoon?
Only at
A lot of people, even eye opener, stop with you in the morning. Yes, now.
From experience,
it's very questionable.
Some people, seriously.
Anyway, the worry blood in you is speaking.
If you've been with us from the illustration segment, you notice that we talked about the obstruction of the airway as well. If all else fails, please remember that when you see the consultant, so people have this chronic tonsillitis,
and they have been enlarged and all of that,
even a deviated septum, boxers, when they have trauma, there's a septum that divides the nostrils, that can be displaced, it can cause a problem. Surgery might be an option. Don't frown at it, because believe me, once you've treated that, you have a better quality of life. Right.
So that would be that they probably need to see an ENT specialist who will decide if the surgery will be done and all. And the sleeping position goes a long way, absolutely.
True. Sleeping position goes a long way because, like we talked about, if the airway is relaxed, the air cannot pass properly.
Absolutely.
You can prop yourself up with some pillows Apart from that, you can also sleep on your left side. That also helps. It reminds me of a story a patient of mine said. He said the noise that the husband was making was so much. She took all the pajamas and sewed a tennis ball to the back of the pajamas. So he couldn't sleep on his back. He had to turn.
I'm sure she would have gotten that from one of the research they had on the internet. Because what people advise is that you put like a tennis ball, put in a socks, and then tie it to the back of the pajamas. Because you know that you can't sleep comfortably that way. So you have to sleep on your side. So maybe you want to try that.
What about the tennis ball? Maybe I'll try it this night.
So now you know you snore.
And that's the point. Not to say that I snore. I'm going to try it and see if I can sleep on it, not because I want to stop.
You'll be all right, Doctor. Okay. What questions do we have?
Anyway, on our social media platform today, it's a different one.
Okay.
It's not like other questions we used to get. Today, we have a manual, and the question is directed to us.
Really?
But the question is about us. Look at what Emmanuel says. Emmanuel says, "Dear doctors, what would you do if you realize that you snored the night before going to work?"
If I realize. Yeah, I believe we know better.
You go up and go to work. Nothing is happening.
No, for me personally, I'm going to want to find out if I have any nasal infection.
And how long I've been snoring?
No, it's just the night before. It's just the night before.
No, but if I just snore the night before, I want the person to observe. Let me see other nights. Am I still snoring? It may have just been maybe my sleeping position. Who knows? Anyway, so I want to see for some other days.
Overly walked. That's one thing we didn't talk about. You may have been overly walked and stressed.
And then your muscles now
had to
collapse. Or let's not say collapse, relax. Yeah. So Emmanuel, you already have it. Basically, they don't want to do anything. They're giving excuses for whatever they are. But basically, if you snore the night before just one time, I'm not going to be that worried about it. But if it keeps repeating, just as
habitual,
then you have to check it out with a physician.
Exactly.
That's basically what I think. Yeah.
So that has been our show for today. We're talking about sleep apnea and snoring. I'm sure our listeners now, our viewers now know better. So please, if you have anything related to this, you want to speak with your doctor, the conversation continues on our website. It's cooltv.cool. On Twitter, you can follow us at WTD or hashtag WTD to tell us anything. Or if you have something that you want us to discuss about.
Yes, like telling us their inventions instead of a tennis ball, what you just did to
right, whatever it is, please share. We always like to share these experiences with everyone. So I think we've had a field day today.
Yeah.
Thank you so much for watching today's episode, and please stay tuned with us next time. So, like we keep saying, stay healthy and bye-bye.
Bye, guys.
Bye.